Hellos, Daktari Explains here again, keeping it as basic as possible. You're welcome from wherever you're listening and watching me from. Today, Daktari is explaining why we spent 6 years of medical school and still come out not having specialized. And it's interesting because if one wants to specialize, you have to go back to school for at least 3, 4, 5, or 6 more years, depending with the particular field one gets interested in. So that is our topic for today. I hope it goes a long way to help all the medical students just enrolling in their first year, and they're wondering, what does this 6-year program really entail? What is this mountain to be climbed? For the parents whose students are just enrolling into medical school, I hope this also makes it easy for you, and for the general public, because having left school, and this I know cuts across for all medical students when you're through, everyone asks, so daktari, ume specialize na? Ama we ni daktari wa? That is, what's your specialty or field? Yeah. So that question is often asked, and I hope that this video will be explanatory to everyone. So first year, second year, third year are called the preclinical years in our setup. Now, I am explaining this program in our setup here in our country, Kenya, but I know that out there different terminologies are used. So this is custom made per se. So yes, first year, second year, third year is preclinical, and fourth year, fifth year, sixth year are clinical. What does this mean? Preclinicals means you're not in the hospital. Ideally, it's classwork, the physical, you're inside the campus or the university, where that's where you get to study from. Then clinical years means your classroom is the hospital. So that is where you do your learning each and every other day. So what happens per year? So first year, second year, we cover the normals. That is the normal functioning of a disease-free body. So the main units here is anatomy, physiology, biochemistry. In anatomy, we are able to interact with the cadavers. Yes, cadavers are the bodies of the departed souls and spirits. And what do we do with these bodies? We cut. We cut from the head to the toe. We are able to see all the organs, the heart, the kidney, the liver, the brain. Yes, we open the skull actually and remove the brain and study it. We're able to see arteries, the veins, the nerves, which sometimes are too small to actually be able to locate them. That is what we do with those bodies. Physiology, we look at the normal functioning of the body. How is it that right now you're able to hear me comfortably? How is it that I'm able to talk comfortably? How am I able to use my hands without them knocking on each other? How are you able to just walk without crossing your legs unless there's a condition? So how the body functions normally is physiology, and biochemistry is the chemical components, and it has its own structures over there of the body. So that is first year and second year. Third year is pathology. I'm aware that some institutions, even in our settings, start pathology somewhere in their second year towards the end, because pathology is big and it's bulky. One of the units under third year is called microbiology, where one has to know all the bacteria, viruses, parasites, protozoa, fungi. All this have to be put correctly in our minds. Yes, that is what happens. Just you have to know the life cycle of all these parasites, and just one female Anopheles mosquito that gives us malaria is enough to make you not sleep. But it is doable for others who have walked the journey. So that's microbiology, and many other units under this big one, pathology. But ideally, this in third year is where now you're introduced to diseases. Remember, first year, second year we said is normal, so now you're learning abnormal. So you're introduced to all diseases and the cause and cause of a disease, how it starts, and the whole progression, and what happens if you don't intervene. So that is our preclinical years. Now, we get to the clinicals, as we had said. Now you bring what you've learned from class to practice. Now in 4th year we learn clerkship. Junior clerkship is where you're trained to listen to a patient. Then now with this information that you've gathered for the last 3 years, you're able to interpret based on their signs and symptoms, what exactly are they talking about, what condition are they likely to be manifesting. So that is junior clerkship. The goal is to be able to just make sense of what patients tell us and come up with at least a diagnosis and probable diagnosis, what we call differentials. 5th year we do the special units. In special units we rotate in things like dentistry, where you interact with the teeth and maxillofacial surgeons. We do the ENT, ear, nose and throat, where you interact with surgeons in that field as well. We do forensic. This is where we learn postmortems. We do postmortems and learn how to make those postmortem reports. We get to see how the whole process of investigations, because people die in either of 2 ways, natural death and unnatural death. So, and policemen is a whole field that are always part of that program. So we're exposed to that forensic as well. Anesthesia, where we learn how to put people to sleep when we're preparing them for surgery, or at least to numb the part of the body that the surgeons will be working on. Radiology, about imaging, we're introduced to all that. So that is 5th year special units. Then 6th year is senior clerkship, and in senior clerkship is now you upgrade your junior clerkship that you did in 4th year. So what does this entail? Now in 4th year you're able to come up with a diagnosis and at least differentials, but now in 6th year, what do you plan to do now? How will you investigate this patient? How will you come up with the actual, remember you had probable conditions that this patient has, so how will you get to the specific one? What investigations and what is the exact management plan? If you're planning to put them on medications, because you did pharmacology, I forgot to mention it along the way. Pharmacology is done some in 3rd year, others 4th year, others I think even in 5th year. So if it's a drug, which drugs and why which ones and why not which ones? So if it's surgery, which kind of surgery? Is it emergency? And also its whole management. Now, so that is in brief summary, year 1 to year 6. And I forgot along the way, research is mandatory. Some do it in groups, some do it individually, but the point is you have to develop a proposal, go to the ethics board, get the committee to approve, do the research, come with your results, make them in a presentable form, give your recommendations, and yes, research is part of the 6-year program. So question is, why all this? Why don't you just take me straight to what I want to do? In my understanding, one of the main reasons is to broaden our minds, to broaden our scope, because most of us come knowing we want a particular field, but along the way we develop interest in many other fields. So the point is to expose the medical students to as many many fields inside this one big field called medicine and surgery, so that now as they go to internship, where now they are the ones calling the shots and being responsible for their actions, they already know what they are likely to now come back to school to do, which is what we call speciality. So that is medical school in a nutshell. In very brief, it has its own challenges and its own blessings, but others have worked, so no one should be discouraged. It's doable, and I hope that this video has given you a good hint of exactly what you'll be covering along the way. Be exposed. So the point is exposure, exposure, exposure until you know exactly where you fit in. To our public, it's so compact, we can't specialize. So that is why we come out still yet to go back to school again. That's all for today. Be sure to ask me any questions if you're curious about something along the way. If you're a medical student, you've just finished and you've been asked this question, give me a thumbs up and tell me yes, the questions are there and we're being asked. If you're a medical student who's just enrolled and you're wondering what is in it for me, I hope this video achieves to explain to you what is ahead. Have a beautiful time from wherever you're watching me from. Cynthia Njogu is my name and I'm a medical doctor by profession. It's goodbye for today. Remember to subscribe, to like and share.